I want to start this video off by saying that you are doing an excellent job. And I know you're doing an excellent job because you clicked on this video and you've taken 5 minutes out of your day to sit down and learn about how to best care for your loved one who has dementia. In this video, we're going to discuss how dementia affects communication and swallowing. I'm going to share some examples of what this may look like realistically on a day-to-day basis, and I'm going to help you differentiate between mild, moderate, and more severe changes related to communication and swallowing. I've broken this caregiver guide down into 3 separate videos. This video is understanding dementia and its effects on communication and swallowing. The second video is a guide discussing ways swallowing safety may be improved at home. And the third video is also a guide discussing ways communication may be improved at home. If you're new to the channel, welcome. My name is Danetta Davis. I am a medical speech language pathologist, and I create videos regarding communication and swallowing disorders that can arise in conditions like Parkinson's disease and stroke. Please do me a huge favor and like this video. It really does help my channel to get found by other caregivers who are looking for this exact information. If you find value in this video, please do me another huge favor and subscribe to the channel. My goal is to reach 5,000 subscribers by the end of this year. I'm literally already halfway there, and I am confident that both you and we can definitely get there together. I'm also excited to share that in the next coming weeks, I will be offering an opportunity to become a member of the channel. And as a member, you'll receive exclusive access to therapy demonstrations, additional caregiver training and education, and opportunities to ask me specific questions for educational guidance. Again, go ahead and subscribe to the channel, and please stay tuned. Let's start with the question that brings most people here, and that is, what exactly is dementia? Clinically speaking, dementia is an umbrella term used to describe a group of disorders that results in a decline in cognitive functioning severe enough to interfere with a person's ability to perform everyday activities independently. Dementia is not a disease itself. Instead, dementia is a collection of symptoms caused by changes occurring within the brain. These changes can affect memory, attention, problem solving, reasoning, judgment, language, communication, and even swallowing. In other words, dementia is not one thing, it's the result of damage occurring to different areas of the brain. And depending on where that damage occurs, the symptoms can look very different from person to person. The most common form is Alzheimer's disease. And Alzheimer's disease occurs when abnormal proteins accumulate within the brain. Over time, these proteins interfere with communication between brain cells and eventually lead to cell death. And this process often begins in the areas of the brain responsible for memory, which is why memory changes are frequently among the earliest symptoms.
How old are you?
What?
How old are you?
Right now? Let me see. I am about, ya ni lo cuento. Ahorita te digo, wait a minute. I was 30, I say about 42. No?
You're 42 right now?
Huh?
You said you're 42 right now? Okay. Well, yeah, you look 42.
So how old am I?
How old am I?
77.
Oh, God. 77.
Yep.
God. 77.
Mm-hmm.
Okay, whenever I... How old am I?
77.
77. See, I don't have a lot left for that.
You never know.
All this stuff.
That's okay.
How old am I?
77.
Another common type is vascular dementia. Vascular dementia occurs when blood flow to the brain becomes disrupted or reduced. And this can happen following a stroke or as a result of chronic damage to blood vessels within the brain. There is also something called Lewy body dementia. And Lewy body dementia occurs when abnormal deposits of a protein called alpha synuclein accumulate within the brain. Individuals may experience changes in thinking, attention, visual perception, movement, and alertness. And finally, there is frontotemporal dementia. And as the name suggests, frontotemporal dementia affects the frontal and temporal lobes of the brain. And these areas play an important role in personality, behavior, decision-making, language, and social communication. Now, while these conditions have different causes, they all share one thing in common. They affect the brain. Changes in communication and swallowing often occur as dementia progresses. To understand why, let's briefly talk about what communication actually requires. Communication is much more than talking. Communication requires attention, memory, processing information, understanding language, finding the right words that you want to say, organizing your thoughts, and it requires coordinating the muscles actually responsible for speech production. When areas of the brain responsible for these functions become damaged, communication becomes more difficult. This is why someone with dementia may begin repeating questions, have difficulty finding words, lose track of conversations, or have difficulty expressing their wants and needs. The same concept applies to swallowing. Now, many people are surprised to learn that swallowing begins in the brain. Before the muscles of the mouth and throat can perform a swallow, the brain must recognize food, prepare the body to eat, coordinate movement, and send signals to the muscles involved in chewing and swallowing. As dementia progresses, those signals may become less efficient. So, a person may become distracted during meals. They may literally forget to chew. They may hold food in their mouth. They may require additional time to complete a meal, or they may become less aware of food remaining in their mouth.
So we're doing lunch right now, and it's a pretty active time of day for Ben. He kind of gets up and down. But a couple things that make it easier. I use plain colored plates, and they're plastic. Makes it easier to see the food on the plate. I cut the sandwiches in fours. That makes it easier to pick up, right, sweetheart? Yep. Okay. And then we only do like one food at a time, right? If there's going to be another part to the meal, we do that either first or second. And that seems to make it all go a little smoother. Yeah.
While there are formal staging systems such as the Global Deterioration Scale and the Functional Assessment Staging Tool that a lot of healthcare professionals may use, I do find that many caregivers benefit more from understanding what these changes actually look like realistically on a day-to-day basis, rather than having the caregiver focus on whether their loved one is a stage 4 versus a stage 5. Instead, let's talk about what mild, moderate, and more advanced dementia may look like from a communication and swallowing perspective. In the earlier stages, many people are still relatively independent. So they may still be driving, managing their own personal care, participating in social activities, and carrying on meaningful conversations. However, subtle changes often begin to emerge. So you may notice increased forgetfulness, occasional word finding difficulties, increased pauses during conversation, difficulty remembering names, or difficulty keeping up with more complex conversations. One thing that I often notice in the early stages is that the person is usually aware that something has changed. So they may actually become frustrated when they cannot find the word they're looking for, or they may even become embarrassed when they lose their train of thought. They also may recognize that tasks that once felt easy now require more effort. From a swallowing standpoint, swallowing is often relatively still functional. If changes are present, they are usually subtle. So you may notice that meals may take a little longer, occasional coughing when eating or drinking, or that maybe the person becomes a bit distracted during meals. Overall, most individuals in the mild stage are still able to communicate their wants and needs and eat independently, even though some early changes may be present. This is often the stage where families begin to notice more significant changes in day-to-day functioning. So forgetfulness becomes more pronounced. Your loved one may become confused about where they are, why they entered into a room, or what they were even planning to do. They may require supervision for safety reasons and may no longer be safe to remain alone for extended periods of time. Some individuals may wander or become disoriented outside of familiar environments. From a communication standpoint, conversations often become more difficult. You may notice increased repetition, difficulty staying on topic, difficulty understanding complex information, and increased difficulty expressing thoughts and ideas. From what I have observed and what I have heard from caregivers is that this stage is described as feeling like communication is still possible, but it requires way more patience, repetition, and way more support. And this is often the stage where caregivers begin to naturally simplify their language without even really realizing that they're doing it. They often come to face the reality of the dementia diagnosis. Now, in the moderate stage, from a swallowing standpoint, swallowing concerns may become more noticeable. So meals may take significantly longer, food may be held in the mouth for longer periods of time. You may find yourself providing reminders to chew and to swallow and to continue eating. Some individuals may become distracted during meals and may forget that they were even eating in the first place. Another important thing to understand is that insight often decreases during this stage. So in other words, your loved one may not recognize that they are having communication difficulties or that they're having swallowing difficulties, even when those changes are obvious to the people around them. In the later stages, individuals may become increasingly dependent on caregivers for assistance with all activities of daily living. And this may include assistance with dressing, bathing, toileting, eating, mobility, and personal care. Communication is often significantly affected. Some individuals may communicate using only short phrases, a few words at a time, with their facial expressions and or with gestures. Others may have difficulty consistently expressing wants, needs, discomfort, hunger, pain, or they may not communicate these changes at all. This is one of the reasons caregiver observation becomes so important during the later stages of the disease. Now, from a swallowing standpoint, swallowing difficulties often become more significant, so 100% supervision during meals would be required at this stage. Meals may take considerably longer to complete. Food may remain in the mouth for extended periods of time. Some individuals may require ongoing chewing throughout the entire meal. Others may demonstrate coughing, choking, weight loss, reduced oral intake, fatigue during meals, recurrent respiratory infections, or just failure to thrive. And at this stage, caregivers are often doing much more than just simply preparing meals. You guys are actively helping to support safe eating and safe drinking. And one thing I want you to remember is that dementia does not always progress in a perfectly straight line. Some days may be better than others. Some individuals may retain strengths in one area while struggling significantly in another. The goal is not to determine an exact stage. The goal is to recognize changes, to understand why they are occurring, and to know when additional support may be needed. So now that you have a better understanding of what dementia is, why it occurs, and how it can affect communication and swallowing, my hope is that you walk away from this video feeling a little bit more confident and a little bit more prepared to understand what you may be seeing on a day-to-day basis. In part 2 of this Caregiver Guide series, we're going to shift our focus specifically to swallowing. I'll be discussing ways swallowing safety may be improved at home, why having a team-oriented approach is so important, what current treatment options are available, when it may be appropriate to seek help from a speech-language pathologist, and what speech therapy may actually look like for someone experiencing swallowing and communication disorders from dementia. If you found this video helpful, please do me a huge favor and like this video. It really does help YouTube share this information with other caregivers just like yourself who may be looking for support. And if you haven't already, go ahead and subscribe to the channel. Thank you so much, and I will see you in part 2.